Hi guys and welcome back to my channel. If you're new here, my name is Faris. I'm a third-year dental student currently studying in London, and today I'm joined by a very special guest. If she would like to introduce herself.
Hi everyone, I'm Raina. I'm a fourth-year dental student at Sheffield and I have a YouTube channel called Raina on the Cusp.
Yeah, great. And today we're going to be looking through some pretty annoying dental myths, some things that, you know, make our blood boil a little bit, and just letting you guys know what we think about them, really. So yeah, let's get started. Okay, so the first myth is dentists don't deserve to have the title of doctor.
Oh, so I feel like this one is just, it's a difficult one because we aren't qualified to look at the whole body, so we aren't registered medical practitioners. However, we've kind of already specialised by going to dental school, so it's like if you went to medical school and then you specialise in, I don't know, the heart, so you're a cardiologist. We've kind of already done that, so we're a doctor of, you know, the head and neck and the mouth region. So we do deserve the title of doctor, in my opinion. Yeah,
I think we're pretty deserving of it. It's just, I've said this before, I always think of it as we're masters of the head and neck, we're masters of that region. That is the whole point of our study. Yeah, exactly. Like, I don't really know why the debate's there. I feel like it's more of an ego thing than anything else. Like, you know, some of the medics are just like, you know, we're the only ones that deserve to be called doctor. But yeah, we ran some polls, actually, myself and Raina on Instagram like a week back, and I'm pretty sure most of you guys said that we do deserve to be doctors. So, you know, shout out to the subscribers.
Yeah. Shout out to the real ones.
Shout out to the real ones, exactly. The next myth is dental treatment is very repetitive and boring. Well, okay, I'll take this one because some of it is boring, I'll admit. I'm just going to say it straight away. Like, sometimes it can be a bit repetitive. If there's things that you just don't really enjoy, you just feel like you're just kind of repeating the same thing over and over. However, there are definitely so many parts of dentistry. Endodontics, I hate endo, everyone hates endo, okay? I just want to make this clear. If any dental student says they like endo, there is something wrong with you, okay? Just want to make that very clear. Yeah, that's horrible, but with regards to it being repetitive and boring, I don't agree, because there's so many cool things you can do in dentistry, and there's just different procedures, and every patient is so different.
One of my friends actually loves endo, but I'm not the biggest fan myself, I will admit.
Yes,
but there is so much, you know, so many different things you can do as a dentist, and the treatment is really varied. I've just started Outreach, which is where I've been working in a dental practice outside of the dental school, and I'm working there 9 till 5 as a dentist, and every single patient that walks through the door, there is just something different to do on every one of them. So
let's just, you know, forget about that one. Dentistry is definitely not boring, not that repetitive. We do a lot of stuff. I promise you, we are cool, all right? We're cool people. I don't think anyone cool ever promises they're cool, but anyway, whatever. Cool. All right, the next one is, there is no need for it to be a 5-year degree, you just extract teeth. I'm just gonna throw this one up at Raina because I know she's gonna say some things here.
Oh, trust me, there is definitely a need for it to be 5 years. Like, I would want it to be 10 years if possible. Like, there is just so much to learn, and especially in the last year, we've lost so much clinical experience. Like, I need the time to be able to get the experience, get my targets, and you need the 5 years to be able to feel confident. Like, you're literally going into someone's mouth with a drill, and you have to be, you know, skilled and careful, and as Faris said, you know, before, being a safe beginner. And you just need so many hours of doing that, so yeah. Yeah,
I remember one time one of my lecturers told me that if he could, he would have made the dental degree 8 years so that we actually covered all the things we needed before we practiced, so
yeah.
There's even an argument that it should be longer, so, you know.
Yeah.
That's not even come from me. The next myth is, you should not do dentistry if you do not have perfect teeth. Well, I'll tell you something, guys. I don't have perfect teeth. I have a lovely gap right down the middle of my teeth. Like, they're not the whitest teeth in the world, you know, and I'm doing dentistry, so I'm pretty sure it's not true. It doesn't really matter.
Yeah, I think you definitely don't need perfect teeth to be a dentist or, you know, be in dental school at all. I think where the results get skewed is because we are obviously taught a lot about teeth and how to look after teeth, so disproportionately I think a lot of us are aware of how to keep our teeth healthy. So I think that's where it kind of comes across that maybe we have slightly better teeth.
And a little tip for you guys, if your dentist tells you to wear your retainer after you get braces,
Yes.
Wear your retainer after you get braces so you don't get a gap like some people. Yeah, I had to find out the hard way, but it's okay. Now that's why I'm doing dentistry. I'll fix it in the future. And the next myth or annoying thing is that dentistry is the most depressing job and it has really, really high suicide rates. Now this one's a bit of a somber one, a bit of a sad one. It is true that unfortunately the suicide rates are relatively high when it comes to a profession in dentistry, and that is because it is quite a stressful career, it's quite a stressful job, a fear of litigation, etc. It is something that has to be considered, like we're not trying to downplay it. However, it's important to understand that yes, there are some struggles with dentistry and yes, they can be very, very serious. However, that shouldn't be the sole determinant, the sole thing that kind of puts you off of the profession as a whole, because there are so many amazing things that you get to do as a dentist and the career itself is very, very rewarding. And kind of leading off this whole idea of like the stresses and how money can be a stressor in dentistry, it's the next myth, which is dentists are only in it for the money and all dentists make millions and millions and millions.
Yeah, this couldn't be further from the truth. It is true that there are, you know, big private dentists out there that make a very healthy income from dentistry, but generally, you know, it's not millions at all. I'm not saying it's not a good salary, but it's definitely not the amount that people think, especially as a foundation dentist. I think it's somewhere in the region of 20 to 25,000, I think, after tax that you get for that year. So it's not the highest salary, but it's not a bad salary at all. But it's definitely not in the millions, and we're not in it for the money because the degree is so long, the training is so long, and we have to keep on learning forever.
I say this a lot, there's just so many other degrees that you can do that can guarantee you the big bucks. With dentistry, yes, there is an element of a financial gain, like we're not going to lie and tell you, oh, we don't make any money at all. However, it comes as a result of the effort that you put in. So it's not just like, oh, you do dentistry straight away, you're going to be making millions. It's more like you do dentistry, you're good, you work at your craft, you really go on those extra courses, you learn more, expand, etc., then you'll be successful. You got to network, guys. That's a big thing I'd say.
Yes,
network, get to know people, and then develop. The next myth that we have is that dentists get no free time, and you know, dental students as well. I think we're busy, I'd say that. I'd say we are definitely busy in terms of dental students and dentists as a whole. However, I don't think it's to the degree where I feel like I'm suffocated by work all the time, or I feel like there's just no free time at all. That is 100% not true. And it just upsets me sometimes when I see people saying, oh, but I don't know if I can deal with the workload, I'm really worried that I'm not good enough, etc. And that's just not true. Yes, it is difficult. However, you've got a lot of people around you that are going through the same struggles. So you kind of look around and you're like, okay, everyone's kind of struggling. I'm struggling. This is normal. And you can work your life around dentistry. It's not like it's a set thing and you have to dedicate all hours of the day to just dental school.
Yeah, I'm really, really passionate about not letting dentistry take over your whole life, and you're not just a dental student whilst you're in dental school. There is so many opportunities to do other things, especially in first and second year. You do get a lot of free time, at least at Sheffield. We had half days, full days off from dentistry where we could do different activities, join societies, and I'm just such a big advocate for having a life outside of being a dentist because it can be very consuming if you let it be. Yeah,
and I want to build up on Raina's point about first and second year. The most common thing you kind of see with people in first and second year is that they think, oh, I need to work really, really, really hard, need to learn everything, and just make sure I cover everything in dentistry. Just don't think of dentistry as the sole thing in life, because you're going to be getting plenty of that once you exit the first 2 years. You're going to be doing a lot of clinical practice, you're going to be getting that high workload. So enjoy those first 2 years, join societies, have a social life, enjoy yourself. I'm not advocating to neglecting the degree, because that is not what we're saying here, but I am definitely saying that you need to have a balance, and it's so important. Okay, so the next dental myth we have is that dentists don't work as hard as nurses and that they don't deserve as much recognition as they get. Ooh, so this is a controversial topic. I agree with the fact that dental nurses don't get as much recognition as they should, I think. But that's in the wider public. I think in the dental practice, there is so much respect between the dentist and the dental nurse. And I will say this with confidence, we cannot do anything without our dental nurses. They are so important when it comes to dental treatment. There's this whole concept called four-handed dentistry, and I'm telling you now, I only have two hands. So the nurse is the person that's there and helps you actually provide these treatments and do these life-changing things for patients. So I feel like within the dental practice, it's really, really appreciated. Maybe from the outside looking in, people feel that there's not that much recognition, but I just don't think that's the case. And the next myth that we have here is that being a dentist is easy. Again, I'm just gonna let Raina go for this one because I feel like she makes the best points.
Okay, so being a dentist is easy. Well, yeah, obviously not. I can now firsthand say from being in 4th year and having to work in a practice that there is just so much to think about. One of the key differences being a dentist is that you have to think about everything. So right from when the patient walks into your dental practice, you are greeting them, you are assessing them, trying to see what's going on. For example, root canal treatment is such a complex thing, and having to explain it in a way that the patient can understand and consent, that is something that takes time and a lot of experience. So it's definitely not easy. Definitely not.
And because I know the comments are going to say this, with regards to like dentistry versus medicine and the ease of both of them or which one's harder, there's different difficulties in both. It's kind of like comparing apples to oranges. It's just a bit of a... The skills, there are similarities definitely, but there's definitely differences, and it's just hard to say which one's easier, which one's harder. The only thing that I will probably say is that as dentists, you get a lot more responsibility when you're first out there. As a medic, you kind of work your way up. So you're like SHO, you're registrar to consultant. I know there's a few more in the middle, but they're the main ones. And throughout there, there's a lot more support, there's a lot more supervision than with dentistry, where you're actually just straight away going straight on those patients, obviously with people there with you, but I think it's just a bit more hands-on, and that's where the difficulty lies. Hey guys, so thanks for watching. If you want to see some more dental videos, check out the playlist here and here. And to see the rest of the myths, make sure you go and check out Raina's channel and also drop a subscription.
Thanks for having me. Bye.